Hi, my name is Brian Gomez, and today I'll be demonstrating PEG tube maintenance. So I'm going to go ahead and check the doctor's orders and make sure that this is the right patient in the right order, and it is. So I'm going to go ahead and enter the room. I'm going to wash my hands, and I'm going to go ahead and I'm going to don clean gloves. And I'm going to identify myself to the patient as well. Hi, I'm Brian. I'm the nurse today. Can I ask for your first and last name and date of birth? And he tells me that, and go ahead and check the wristband, and yes, this is indeed John Smith. So then I'm going to go ahead and inform him about the procedure. Hey, so we're going to do today a PEG tube maintenance. I'm just going to make sure everything is going okay with your feeding tube. Okay, any questions at the moment? No? Okay, so I'm going to go ahead and close the curtain for privacy, or close the door, whichever is applicable. I'm going to have my equipment here. I'm going to go ahead and fill this up with 30 cc's of tap water. I have my pad for making sure that everything stays clean, irrigation tray if needed, and also my Toomey syringe. So I'm going to go ahead and raise the table up to working height. Simultaneously, I'm going to also turn off the feeding pump. I'm going to raise the table to working height. I'm going to go ahead and lower the side rail, but I'm going to raise this to about 45 degrees as well. Now, Mr. Smith, are you feeling any nausea or any pain or any discomfort or anything? No? Okay, so if he reports no, I can go ahead and continue my assessment. So I'm going to go ahead, Mr. Smith, I'm actually going to go ahead and examine and look at your abdominal area and make sure there's no redness or distension, okay? So I'm going to go ahead and carefully expose the abdominal area. I'm going to go ahead and look, and okay, so I don't see any redness or distension, but I'm going to go ahead and auscultate and make sure that everything is okay. And again, the rule here, there's 4 quadrants, and I want to listen for anywhere to 5 to 30 movements within a minute of each section. So here, I'm going to listen over here. 2 section, 3 section, 4 section. Everything sounds normal. Again, each quadrant will be for about a minute, just making sure that those are appropriate sounds. I'm gonna go ahead and I'm gonna just put that in this pad just for cleaning, for maintenance and cleaning, to make sure nothing gets spilled unnecessarily. I'm gonna go ahead and kink the tube, just to make sure that nothing comes out from the stomach contents. And I'm going to remove the feeding tube. I'm gonna hang it here. Grab my syringe. Now the rule here for the PEG tube is that we want to be pulling out anything under 100 cc's. If it's more than 100 cc's, we want to stop the procedure and notify the doctor. In this case, we're going to do only 30 cc's, and we're going to say that's normal for this patient. So I'm going to go ahead and I'm going to pull out 30 cc's. And at this point, I'm also going to assess and make sure that there's no discoloration, there's no blood in it, so it's pretty uniform with the formula that's being fed to the patient, and it is. So I'm going to nice and slowly put this back into the patient. Mr. Smith, you still doing okay? You want to make sure that your client's doing okay as well. That's there. I want to go ahead and close this, or kink it again. I'm going to go ahead and I'm going to get 30 cc's of tap water. And again, same thing as before, I'm going to make sure that I insert it very slowly into the patient. Okay. Doing okay still, Mr. Smith? It is okay. I'm going to go ahead and I kinked over here. I'm going to go ahead and grab the feeding tube again. Put that back into the PEG tube. I can unkink. I'm going to turn that back on, and it's going to be resumed at the regular rate that it was unless the doctor ordered otherwise. I'm going to go ahead and remove my pad, place it over here with my other equipment, and again I want to drape the patient again for privacy and comfort as well. I'm going to raise the arm rail again for safety, and I'm also going to lower him down to the lowest height. And I'm going to ask him if he would like to, if he's comfortable, I can always decline him or incline him, whichever. I'm just going to drop just a little bit. Okay, so comfortable, everything okay? And the arm rail's up. I'm going to go ahead and I'm going to wash my hands. I'm also going to, because with the syringe, this is good for 24 hours. So I'm going to go ahead and I'm going to wash this. I'm going to write my name, time, and date. That way, and if it's me next or the other nurse, they can use this again up to 24 hours. I'm going to also put the call bell here, just in case he needs me for anything else later on. I'm going to also then now remove, I'm going to also place this equipment in an area that I can access, or the future nurse can access. I'm going to also then remove my gloves and wash my hands And I'm gonna look and check the feeding and make sure there's enough feeding. If they need to add more, I'll add more. If not, it's okay. It's okay, it's good here. Then I'm gonna go ahead and I'm gonna document the input and output and anything else notable I found. And that is how you do PEG tube maintenance. Thank you.